Now, we're all keen to learn about new ways and little cheats to looking and feeling great. So I've been looking around Riverbank's clinic and talking to staff to find out what's going on behind the treatment doors. Dr. Jain, what treatments are the most popular here at Riverbanks?
Without a doubt, our most popular treatment is the VASER Lipo sculpture treatment.
So what is VASER?
Okay, VASER is essentially ultrasound assisted liposuction. What does that mean? Okay, because normally when we say to people liposuction, they're afraid and they think of all sorts of gory graphic images and brutality, you know. I need to reassure patients the beauty about the VASER method of fat removal, of lipo, is that it's a much gentler form, okay?
Right.
And it's much more precise than traditional forms, okay? And it also offers a quicker recovery, okay?
Right.
That does depend on who's doing it, okay? It's not just the VASER system allows you to get great results. It's a tool, and it's an artist tool, okay? And you know, we find we get best results using the VASER system. We have tried various other methods of liposuction, and this one allows us to get the best possible results for our patients.
Does the procedure still involve something which is minimally invasive, where you are having a probe that's inserted rather than something which is it ultrasound that's on top, but then you've got liposuction as well, which is...
Okay, well, you're right, it is a minimally invasive. There will be probes and instruments passed into the body, like in this manner, which they see. But what happens, the ultrasound is passed through a probe into the fat, directly to the fatty tissue, and it lets out an energy which is only absorbed by fatty tissue. So the probe will only work on fatty tissue. It won't work on blood vessels, it won't work on nerves, it won't work on skin, it won't work on muscles. Okay, so you're only treating the fatty tissue. And what it does, it turns that fatty tissue into liquid. So that when we remove the fat, the vacuum, the power of the vacuum is much less powerful than traditional liposuction, where in the old style of lipo, you had to literally suck the fat off the body.
Wow.
Which is quite traumatic. There's much more blood loss, that is less specific. This way, we can use a gentler suction and allow, therefore, less damage to the body, and that means a quicker recovery, and it also means you can work in more delicate areas.
Now, there's a lot of other sort of treatments and machines I've seen that are out there which all claim to do probably similar results, but they only tend to work from the outside. And I mean, seeing some of the results, you know, you can achieve some pretty dramatic results, and there's different types of VASER, isn't there? Which different types of forms, like you talk about the 4D VASER, etc. I mean, can you explain a little bit about, you know, the different types of modalities?
Okay, fine. So, as I said, VASER is a ultrasound-assisted form of liposuction. It's an instrument which I use to give the best results, okay? There's basic VASER, which many people would compare that to traditional lipo with some benefit, okay? Where you may treat a small tummy or a small area of fat, maybe a fistful of fat in an area, okay? And there's not really too much sculpting associated with that. Then there's advanced levels of VASER where you treat trickier areas such as the chin area, the jowl area, the arms. These are very difficult to get right. Maybe the inner thighs, okay? Very difficult to get right, okay? And you need quite a lot of experience and training for that. And then there came the high definition type of VASER, where you'd be looking to create six-packs in people, and this revolutionized liposculpture. You know, this allowed us not only to give athletic-looking bodies to men and women, but it also meant that we could treat slimmer patients. Because before, lipo was traditionally for the fuller patient, not necessarily desperately overweight, but the patient who had a bit more fat to them. And the VASER 4D has taken that high definition work to the next level. I mean, it allows to compensate for dynamic movements of muscles, to help women look even sexier, men look, you know, even trimmer. It's just taken the next level, and it allows you to really look at a patient with a different set of eyes and say, how can I make this patient look the best they can?
There's a bit of controversy over the more sculpting. Someone comes in and, you know, they are pretty toned, but then, you know, you're treating them, and then to sculpt those abs. I mean, I suppose there is a little bit of vanity around it, but yeah, I mean, I would love to have a six-pack again. And, you know, when you get to a certain age, you know, you can go to the gym, and I'm sure you can achieve a certain amount, but I mean, you've actually had it done, haven't you?
There's no doubt that six-pack surgery is about vanity.
Yeah.
We don't need to
Could
show
you
off our
overdo it?
six-packs. Could you overdo it? I mean, in what way? I mean, I think you could get, some people have a 10-pack, for example. They may naturally have that musculature in there, you know? So all we're doing is revealing someone's natural shape.
Right.
But what's important to separate here is that women don't tend to go for the six-pack, okay? Because that doesn't look very sexy or very feminine for most females, okay? We tend to do what's the twin pack for the females, and we give them a very sexy waistline. We give them the nice midline muscles, so down the middle here, down the side, so they have that sexy lines of definition, okay? Which makes them feel so confident. You know, they come for their 8-week check and they've got figure-hugging clothes. You know, they've already booked their holiday, you know, where they're going to be in their bikini, okay? And the men just love the fact, because they work out even more afterwards, because they now don't mind going to the gym with tighter clothing on, because, you know,
it's like giving a head start almost, isn't it?
Yeah, exactly. I mean, that's how I say to my patients. I say to them, you know, the six-pack surgery, the lipo, what we're going to do for you, imagine you're in the Olympic meters final, okay, and you've got Usain Bolt next to you, okay, and we're going to put we're going to put you on the 90-meter line, okay? You got to beat him still. Now, if you stand still and do nothing, he's still going to beat you, okay? You've just got to do that extra bit. So we're giving you a massive head start to get to where you want to go to.
And now, Dr. Jain, you are the only doctor in the UK who is able to operate all 4 levels of VASER.
That's right. Training is really key to me. I want to make sure I offer them patients our best possible work as well. I want to give them the best results, okay? And I've been to various specialists around the world to make sure I get the experience required to do this specific type of liposuction, and it is highly specialised. It's not to be confused with regular lipo in any way. And it's a passion for me, and I'll always, when the next level comes out, I'll be on that course.
You'll be on that one. Now, is it a situation like you're standing in front of the patient, talking about it as an artistic tool, and you feel a bit like Leonardo da Vinci, and right, let's start, and would you like this, and would you like that? Does it inspire you with the knowledge that you have of what you can create and the power that this brings?
I love it. I mean, it's so exciting to be able to, you know, to see someone where you know that you're going to be able to give them an amazing shape. Yeah. And, you know, in the operating theatre, you know, the patient's shape is our canvas, effectively, and then at the end of it, when we get to the shape we want, you know, it's not just me who has to judge, it's my assistants who will say, yes, this is right, or no, you've missed a bit here, go back there. Even the anaesthetist is checking that we've all got to the level that everybody's happy with, you know, so, you know, and it's only when we're all happy that we end, and we're, you know, hopefully we're confident that the patient's...
Well, I mean, the results look amazing, and I think, you know, there's so much great information out there on your website. I think if you are looking to have a treatment like VASER, it's really important to book in for a consultation and find out what's going to be best for you.
Absolutely.
So thank you very much for your time, and as I say, tweet in, get your posts in, and let Dr. Jain give you his insight.